Good morning. Thank you everyone for coming. This is the executive member decision session for health, wellbeing and adult social care. I am Councillor Jo Coles. I'm the executive member for health and wellbeing and adult social care, and I'll be chairing the session today. Thank you everyone for coming. We've got 7 items on the agenda. And I'd like to welcome Angela Padfield, who's going to take agenda item 4, which is around York Learning. Ruth Hine, who's a public health practitioner, who's going to take agenda item 5, along with Sharon Stoltz, the Director of Public Health, and Sharon will lead the item 6 on public health, which is the annual report. Can I just first start by any housekeeping? That we're not expecting a fire drill, and I'll move straight on to the declarations of interest. Does anyone have any declarations of interest? I assume it would be me, and I don't, so we can move on to the minutes of the previous meeting, which was on the 18th of July. I was present at that meeting and I could confirm they're an accurate reflection. Do I just need to sign these? Oh yeah, great, thank you. So we'll move on to public participation, which there are no registered speakers, although I would like to acknowledge Councillor Runciman, who is in the room to observe. Thank you for attending. And I'll move straight on to item 4, which is York Learning, the York Learning Annual Strategic Plan. And thank you so much for coming, Angela, and we wish Paul a speedy recovery. We know he was unable to attend today, but if you'd like to just present your report, and I've got a couple of questions for you when you've finished. Thank you.
Thank you. So this is our annual strategic plan, which we produce one every year, and it's part of the governance of the service that we go to our governance board and we come here to, as part of executive member oversight, to get agreement for what that plan will be. The Annex A is where the actual report is, and most of it's been based on the accountability agreement, which you agreed in the previous meeting, which you just agreed the minutes for, actually. The benefits and challenges are that we are trying to match the strategies that are going on across the city to make sure that the skills that we're developing towards will meet those needs that have been highlighted within those strategies. It's quite a few strategies we're trying to connect to. So there's the 10-year York Skills Plan, the York's Economic Strategy, and the Local Skills Improvement Plan, which is absolutely relevant now to where we have to be when we're thinking about how we plan our programmes and what skills we're trying to develop into to meet the regional need. Our funding is very much wrapped up within that, and as we move towards the combined authority, it will become more important that what we deliver meets the Local Skills Improvement Plan, and that's where the accountability agreement came from, if you like, where we based it on. So what we've got is the Annex A, which is where we've set that out as designed against the accountability agreement. The council plan priorities were what I saw at the time. And what I've gone through is how we think we're going to meet those needs. So the national skills priority is pathways to be developed, for example, using the Local Skills Improvement Plan national priorities as pilots within FE. And that's just one of those. There's loads of text in here, I realise that, and I'm not going to put you through all of them, I promise. And one of the ways that we're going to increase progression is to collaborate with other local education providers, which you may want me to go into a bit more later. We are trying to engage with a wider demographic of learners, and on the report basis, communications have said that we need to think about a strategy of how we're going to do that. And I think part of our challenge is not having our own premises means we don't have a focal point to do that, but we've got other ways that we're working with at the moment, and you never know, in the future we may have our own premises. On page, page 16, I've talked about developing opportunities for all staff to have at least one industry-focused CPD day. So that's already started to happen, just to inform you. So one of the curriculum managers has chosen engineering as their area of specialty that they'll get more knowledge on, and how we could create pathways and stepping stones to that skill set. VR and drones, which are also coming to us through the Local Skills Improvement Fund. We've just been approved for funding for that, for 2 years funding, up to about £50,000 to spend on virtual reality, equipment and software and drones. And then also project management is another skill that is quite widely wanted across different employers that we've spoken to and been involved with the local skills team. And that's another one that a curriculum manager has chosen as an area that they will develop more knowledge into. Is that okay? Yeah.
Thank you. Can I just I particularly welcome the opportunity for staff to for the CPD. Anything I can do to support that, I'm very happy to help you with any of that. I just wondered if you could say a little bit more about, you know, the efforts that you're making to widen participation and ensure that we're targeting opportunities at the learners that we need, you know, the learners who need to or have skills that they want to develop in areas that we need. You mentioned some of them, but I do worry a little bit about targeting of resources and of the opportunities at the right people. And then separately, if you could say a little bit about progressions and pathways that are available to learners, so that, you know, they if they start on a course, it isn't a start and finish and they immediately stop learning, and what the kind of progressions are to that. Thank you.
Thank you. First of all, with the engagement with a wider demographic of learners. So we're hoping, we have a wide range of offer which attracts different people and different groups of people. And we market it quite widely. So we still do a brochure drop right across York once a year is the plan now, rather than twice a year, because we're also thinking about sustainability and environment impact. But it is one of those key ways to engage with different groups of people that you don't necessarily engage with. We still do all the social media marketing. We're working with identified groups, if you like. So we work with lots of different charity partners now, with the CVS, with Kira, with Changing Lives, with a vast array of different organisations, Men's Shed, etc., to help develop programmes that engage with their clients. That enables us to meet lots of different groups that maybe wouldn't come to us themselves. And they help recruit those people to come to us. So we're doing quite a bit of Door 84 at the moment. That enables us to engage with them, reintroduce learning for some of them. And then those who are maybe more highly skilled, shall I say, who maybe just lack the confidence to getting back into learning, they'll often come back to us through the more health and well-being sort of offer, and then realise that actually, yeah, this is more fun than when it was at school, and that tends to attract them that way. And then the discussion is there around what progression pathways there are, what do we offer, and everything like that. So it's about opening that door, I think, to try and engage with them. We've still got more work to do on it, still other groups we need to target and other ways of trying to work through it. So I'm not saying we've got it defined yet, we're still doing that piece of work, and a communication strategy may help with that as well, which, you know, any help with the comms team to help us do that would be really appreciated. Each curriculum area itself tries to work with one non-common demographic group, so they'll try and work with different groups to try and make sure that we are bringing them in. So ESOL would obviously attract one group, but what we try to do is get them also introduced to digital, and also we've done dressmaking with them, for example, because a lot of them come from, the men particularly come from a tailoring background, and that often is quite introduced as quite that interests them. It's a skill set, it's something that they could do as self-employed and so on, and so it tends to take them through. Accountancy is quite common for a lot of women within the ESOL programme, so they are also interested in that. So we're trying to match it to where people's interests are, but developing them at the same time. The Multiply project also enables us to start introducing maths in very bite-sized ways. For example, you're making a smoothie what maths is involved in making that smoothie. Did you know you've done X, Y, Z while you were making this smoothie? And that's maths. And actually you weren't scared of it. It was much more fun than you thought, because maths is key to the future skills agenda, because most of the skill sets that we're going to need a good base of maths to get them onto those skills pathways. So maths is key, and the multiply funding is definitely helping us with that, to re-engage with that wider group, if you like, and it's bringing new people in. What was the other? Oh, progression pathways. So our progression pathways, what we see ourselves as the entry point within the city. So we work with the widest group of people with no skills, low skills, furthest away from the workplace, whether that's through health or skills. And they can start at any point. They can start on non-accredited learning, which means there's no qualification, there's no pressure. It gives them a chance to re-engage with learning, if you like, in a non-pressured way. And then they get moved gently into the best place where they should be. So if they are a level 2, they start at level 2. But if they're an entry level learner, they start at entry. We have courses that start at entry level right up to level 2, which is the equivalent of GCSE averages. We have some level 3 programs, not many, but some, because really the colleges are there to provide the level 3. And we've always worked closely with the colleges to make sure we're not duplicating offer, because the funding's one pot, really, in the, especially when come the combined authority, it'll become very clear it is just one pot. So we need to all make sure we're working together to get people through the different offers that are across the city. So, for example, with the collaboration that I talked about on page 12, we've already done cybersecurity. So we did an introduction to cybersecurity, and that's gone to a wide range of people who wouldn't have gone to college to take up cybersecurity. But 4 of those have moved from the course into a proper level 3 course at the college doing cybersecurity. And we had 10 come from dressmaking to go to a degree level course at the college, or go for an introduction day, shall I say, at the college for the technical dressmaking design that they do there. And that has provided the pathway. So we don't do something and then just leave it hanging there. I'm not going to produce an introduction to engineering, for example, and then it has nowhere to go. It has to work with our partners to make sure the pathways are there. We're never going to have the tutors that are qualified fully to teach engineering at all levels, but our partners will do, and that's where it fits within the city. Have I answered your question?
You have. Thank you, Angela. That's great. So I think I'm being asked to consider and approve the report subject to any changes. The only change I did want to request was just around the council plan priorities, just to ensure that they reflect the council, the new council plan, and each priorities of equalities and human rights, affordability, climate and health, and all of that is in there. It's just structured slightly differently to the council plan. But thank you. I'm very happy to approve it subject to that. And I would like to thank all of you, your staff and the learners, and the people out there doing the tutoring and supporting learners across the city for the important work that they do. And I'd like to again reiterate my hopes for Paul to have a speedy recovery. So please pass that on from me. But thank you for your report and for all the work that's gone into it. And I'm happy to approve the report. Is that okay? Great. In which case, thank you. I will move on to agenda item 5, which is the substance misuse report. Sharon, Ruth, thank you both for joining us. If you'd like to present the report to us, that would be great.
Yes, thank you, Chair. Before I hand over to my colleague Ruth, I just want to correct some of the detail in the report. The budget referred to in paragraph 1 and paragraph 18 in the report talks about this work being funded from the 2023-24 council budget growth funding. Just to clarify that the funding will be from the public health reserve. So within the local authority public health grant allocation, we do make sure that we have a public health reserve within that to deal with in-growth, in-year priorities. As the report outlines, which Ruth will describe, we identified some additional areas around substance misuse that we wanted to focus on this year. And so we've actually allocated the 75,000 funding from the council growth budget. So if the minutes, please, could be amended just to reflect the fact that the funding's coming from the Public Health Reserve. And on that, I'll hand over to Ruth. Thank you.
Morning. So of the 75,000 that Sharon's just referred to, we're identifying 50,000 to go to York and Recovery, which is our peer-led recovery charity that works with many people within our community with substance misuse disorder, and many go through that organisation. The other 25 is for the alcohol care team at York Trust, which is already, this is to supplement some funding that we've already identified. Both of these are investments are in line with what we've been looking at through our York Drug and Alcohol Partnership and the council priorities, and just gives that additional support for individuals, for those with substance use disorder, and help with the health inequalities across the city. So just to talk a little bit more about the 50,000 for York and Recovery. So it's a peer-led recovery charity, helping those in the community to maintain that abstinence-based social and community participation, which is seen as a very strong part of someone's journey. There's an established and growing programme around this in the city, and it's going from strength to strength at the moment, and we really feel that this is part of someone's journey, if you like, that will help to support that. At the moment, there's a lot of bid funding for it, and there's, you know, they're getting lots of funding from little pockets, and this is to help form some concrete way forward for them as an organisation to help establish them going forward. The 25,000 is to support the alcohol care team, which we'd already identified some funding through the government's strategic funding. So from the Harm to Hope strategy, from their a supplementary substance misuse treatment and recovery grant, which we get annually come down from the government, we identified some money there. So this is to help give more funding to the trust to establish what they're doing there. Lots of things are happening at the trust. It's just in a starting process to help with those patients with alcohol issues specifically. They will also support people with drug issues as well, going through A&E, those on the inpatients ward to help with safe sort of detoxification, but moving on through into other treatment services when they leave the hospital, helping to reduce the length of stay in the trust, so reducing some of the pressures there, but also for those individuals ensuring they're getting the right care and support they need to go on their journey. So they're the two things that we're looking at.
Great, thank you. It's just some examples of incredibly important and work going on across the city, and things that actually without which health inequalities are going to grow. I was particularly wondering, apologies, I didn't tell you about this before, I was just wondering while you were talking, because we know that drug and alcohol barrier treatments are important as a way of accessing wider treatments, particularly around mental health. I just wondered if you could just say a little bit more about the kind of other services that people are likely to need to refer on to from these services, and therefore the kind of way in which this investment will facilitate those kind of longer term transitions and helping people to recover both from drug and alcohol problems, but also some other wider issues. Mental health came to mind for me. I just wondered whether there was anything else that I should be kind of mindful of from the report.
Yeah, sure. So I think from a York and Recovery perspective, they help and support everybody from across. A lot of them we would refer to as dual diagnosis. So very often those who are involved with needing treatment and recovery around their substance use disorder will also be involved with mental health services. Our colleagues within York and Recovery link in with other professional groups to help support and signpost into and ensure that any individual that might use them as their first point of contact, which often it is, are getting the right support and helping to ensure there's some joined up. Obviously, we have our main provider in the city for the drug and treatment service anyway, and so it's referred to a little bit in here, but actually that's our main provider. And again, they have those strong links and partnerships into other services across the city that will support individuals on that path. Linking in again with the 25k going to the hospital, there's many partnerships. A lot of the work for that alcohol care team is involved with the psychological services and get the support through there to ensure that there's other things. There are lots of initiatives across the city that I think we're all aware of, whether they be charity, voluntary, plus those that are statutory arranged, that support a lot of the individuals that will pass through. So we have our probation service, for example. Criminal justice plays a part in some of these that again will be part of this bigger pathway. The idea of our York Drug and Alcohol Partnership is we have all of these members sat around the table. So we have representation from criminal justice, young people's, children's services, adults. I'm trying to think as I go around the table, that all sit around to ensure that we're not working in isolation, because these people aren't living in isolation. They go through, and a little bit our education colleagues as well, about getting people back into work, and whether that be through voluntary or paid. So yeah, that's how it all kind of fits together.
Brilliant, thank you. Those relationships ultimately are really important, aren't they? From a service user perspective, the important thing is that they're getting the treatment they need, and it arguably doesn't matter where it's coming from, as long as it's the right treatment for them at the right time and it's wrapped around them and their needs at that particular point. That's how we end up getting those people on those pathways out of things. And so it's an incredibly thank you for all your work in putting the report together. I'm particularly pleased that it is part of the core commitment to reducing health inequalities, and I'm very happy to approve the use of the 75,000 for these purposes. Do I need to approve anything else? Is it just the money? But thank you for all the work in the report. It's hugely appreciated, and please also let me know if there's anything else I can do to support the work in this area, just in terms of reducing inequalities and ensuring those pathways are working in the right way to reduce the kind of demand further downstream when prevention doesn't work, and when we need to kind of get into supporting people out of substance misuse. So thank you for everything that you're doing, and I will approve the thing. So I will move on to
Thank you.
agenda item 6, which is the Public Health Annual Report. And Sharon, thank you.
Thank you, Chair. Just to put this in context, really, to start with, so local authority directors of public health have a number of statutory duties, and one of those statutory duties is to produce an annual report on the health of the local population, and the council then has a duty to publish that report. So over the time that I've been in York, we've always developed different themes. So the theme for the report usually is based on something that has emerged as a particular priority that we focused on. So the previous report was about the pandemic and how York survived and came out of the pandemic, for example. So the report this year focuses on domestic abuse. 2 reasons for that. One of the priorities coming out of the COVID pandemic was a recognition that we'd seen an increase in the incidence of domestic abuse, not just in York, but across the country. So York is not unique in that. But nevertheless, there were concerns over the increasing cases of domestic abuse we were seeing. But also, the government in 2021 published the new Domestic Abuse Act. And I think that certainly raised the profile of domestic abuse and put additional responsibilities, not just on local authorities, but on the police, the NHS, other partners to cooperate in tackling domestic abuse, recognising that this is everyone's responsibility. And I think led to the establishment of a York Domestic Abuse Local Partnership Board that brings different partners together across the city, along with very welcome additional investment from government around domestic abuse as well. So that's kind of the context really for why I chose domestic abuse for my report this year. Interestingly, the World Health Organization has recently also identified domestic abuse across the world as a really important public health issue. I think our understanding of the impact of domestic abuse, not just on victims, but their children, extended families, the impact of domestic abuse on wider society, the fact that it's a hidden crime. It often takes place, or usually takes place, behind closed doors. There's a shame in admitting that you're a victim of domestic abuse. And so I think that domestic abuse, therefore, even though some of us have been very aware of it for many, many years, it's certainly got a higher profile now than it's ever had, really. So the annual report is based on the work that the local Domestic Abuse Partnership Board has done over the last year to 18 months or so, but also the work that York has been doing jointly with North Yorkshire Council and the Office of the Police and Crime Commissioner on reviewing our service offer. So looking at recommissioning our support services for victims, survivors, but also perpetrators of domestic abuse. And because we've very much taken a public health approach, an increasing focus on prevention and early intervention as well. So the report talks about that, but also points to the emerging domestic abuse strategy for North Yorkshire and York, which will be coming through the council's decision-making processes over the next few months. So the report sets out 4 key recommendations. First of all, to develop a new domestic abuse strategy. That work is well underway. I've seen a draft version of that strategy. So we should be ready to publish that hopefully before the end of this year, or certainly early next year. The priority, again, around increasing awareness of domestic abuse and introducing targeted learning to young people about abusive behaviours. And one of the reasons why this is in as a recommendation is that we did a school survey 2 years ago in York, which the majority of schools participated in. We're about to redo that school survey. But when we looked at the results of the last school survey, there were some worrying messages in there coming through, really, about young people as they develop their relationships with friends, boyfriends, girlfriends, etc. There really was a lack of understanding about coercive control, for example, around your partner might be instructing you on how to dress, or there might be other issues. So from that, we felt that there was a need to do more education around relationships, which links into the sexual and relationship education in schools. So very important that this work links into schools and education settings. I mentioned earlier that we're in the process of recommissioning our domestic abuse services. So part of that is making sure that those services reflect the requirements of the Domestic Abuse Act. And in that, really, I think the key change is about recognising children within families and extended families as being victims of domestic abuse, and recognising that our support services need to look at that, but also that we don't ignore the needs of perpetrators. So that's going to be really important as we recommission those services, and really looking at the equality impact assessment and ensuring that those services are inclusive and accessible to all victims, irrespective of age, gender, disability, sexual orientation, etc. And then we've recognised the need to more widely capture the voice of domestic abuse victims. Some of that is reflected in the annual report. When the strategy comes through, hopefully the strategy will show that those voices are coming through even more strongly. But I quite like the quote on the front page of the annual report. You know, I didn't have to suffer alone. I got support and became confident enough to report him, in this case, to the police. Although obviously we know that it's not just men who are perpetrators of domestic abuse. But for me, that quote really brings home the importance of this work, that people are supported, that they feel able to report domestic abuse to the police, and then that we have the right support services in place to be able to support people once they've reported. So those are the recommendations in the report. In terms of governance, even though the Director of Public Health annual report is an independent report produced by the DPH, clearly this has been developed within the context of our broader domestic abuse partnership, and also within the context of the Community Safety Partnership for York. So the Community Safety Partnership has an important role in having oversight of the work that we're doing as well. So I'll stop there. I'm very happy to take any questions.
Brilliant, thank you. And I'm delighted that this is the topic of your final report of the DPH. So thank you for this, Sharon. And I mean, there's such a lot in it to kind of draw on, both in terms of kind of how it impacts on people, how it impacts on the city, and people across the city. I've been struck, you know, I've been a counsellor now for just 6 months, and I've been struck in my local surgeries and in meetings in the community by the number of cases that have just come to me as a local councillor, and just the impact that it has on, in both cases that I've come across, the women and their families, and particularly for the children, and the kind of overriding sense differently actually for the two cases that I've come across, the impact of poverty on those families. And so I'm really pleased that this sits with health, and that we've got a health-driven approach to this, but also it's really welcome to see the kind of partnership approach that is being taken. There is a lot of work to do to turn things around, particularly for victims and their families. I am really looking forward to seeing the strategy coming forwards. I hope that there are opportunities from the devolution and the combined authority, particularly a better way perhaps of integrating the police, fire and crime commissioners' work in this area to ensure that we have a really integrated approach between policing, the criminal justice system, and then all the support around victims and their families, and as you said quite rightly, perpetrators. I did just wonder whether you could say a little bit more about how the MARAC works locally, and any kind of thoughts that you had about that. And also really welcoming your recommendations, the importance of capturing the voice of victims, because we know that if we're going to get services right and wraparound support in the best possible way, it's really important that their voices are not lost in all of that. And that can be really difficult and really time consuming and really resource intensive, but is nevertheless the way in which we get services right. So thank you for recognising that. If you could just say something a little bit about the MARAC and any thoughts that you have about the opportunity from the combined authority, in terms of the ways in which you think that might improve things in the future, that would be really welcome. Thank you.
Yeah. So just for those people that may not be aware, we use these acronyms all the time, don't we? But MARAC really refers to the multi-agency work, where you get representatives from different agencies come together, either around a table or a virtual table, to really look at cases that we're become aware of domestic abuse, and looking at those multi-agency plans. It works very well in York. I've always been impressed at the level of trust there is between different partner agencies, and very much the person-centered approach that MARAC takes. Where I would like to see improvements, and hopefully my report and the strategy coming through will facilitate this, is that greater focus on prevention and early intervention. So if we can strengthen our intelligence sharing around where we know families might be at high risk. So rather than waiting for violence to occur and for there to be a report to the police, how can we get better at identifying risks around domestic abuse, and actually seeking to intervene early with support for those families, so that we try and prevent not just the short-term effects of domestic abuse, but we know, particularly for children who have been exposed to domestic abuse, the impacts last into adulthood and can have massive impacts on their physical health and their mental health as they grow. So I'd like to see a greater focus, and that is emerging. I think I would agree with you that having public health lead on the domestic abuse agenda, it used to sit with community safety previously. It came over to public health a couple of years ago. I think we're able to take that holistic population level focus and have a much greater focus on upstream programs and prevention, rather than just being reactive to when a violent incident has occurred. So I think that it works really well. Certainly opportunities for improvement there. With the combined authority, I think we've already seen the advantages of a North Yorkshire York approach. You know, the issues like domestic abuse don't stick to local authority geographical boundaries. It's important that we have that broader focus, recognizing that families can live across local authority boundaries, etc. But also, I think the importance of making the best use of knowledge and expertise that exists across the patch. You know, we're a relatively small public health team in York, so there are advantages for us in working collaboratively with North Yorkshire. But also, if we think about funding, particularly funding that comes through the Office of the Police, Fire and Crime Commissioner, for example, you know, York being around the table, being part of those conversations, being able to show York data, share case study examples from York, means that hopefully we get our fair share of the investment as well. And I think the work with the combined authority, looking at how housing can support the domestic abuse agenda, looking at how we can create environments that are supportive and are safer for people to be able to come forward and say they're a victim, or they're worried about becoming a victim of domestic abuse. I think there are real advantages to having a collaborative approach there as well.
Thank you. I am obviously delighted to approve the report, which I think is what I actually officially need to do. I also just wanted to thank you, Sharon, in this public setting, just for all the work that you have done during the pandemic and on this report, and your commitment to putting health at the heart of what the council is trying to do, and certainly for us as a new administration, trying to ensure that reducing health inequalities is one of our core principles and priorities as an administration. We have obviously not worked together for terribly long, but I do hope that everything that you have started is something that we can now embed in terms of ensuring that health is at the heart of a lot of and all the work that the council is doing. And we will certainly continue to try and strive to do that in the work that we're doing, and follow your example of championing health and reducing health inequalities in the city. And, you know, this report is a testimony to some of that, and I'm sure the previous reports that Councillor Runciman will have taken through these decision sessions and other places, you know, it is hugely appreciated. And I do sincerely hope that devolution does provide an opportunity for us to do more of that preventative work, so that the victims and the impact of domestic abuse can be reduced, and we then have a healthier, happier city, and with healthier, happier residents in it. So I'm delighted to approve the report, and thank you for presenting it to us this morning. Thanks. I think if there is, I'm not aware of any other urgent business, in which case I can close the meeting. Thank everyone for attending and participating.